Hello everyone. Welcome. If you're here for the Presilium webinar on ACA 101, you are in the right spot. So thanks for joining us.
Excellent. And hi, friends, and welcome. We are so glad you've joined us for this special event, hosted in partnership with our great friends at Move Health and Craven. Healthcare and health benefits, especially in retirement, is one of those topics that seems to cause anxiety simply by mentioning it. It's expensive, it's confusing, and it seems to get more complex every day. We are pleased to bring you this special event with one of the leading experts in this area, Craven, a partner and co-founder at Move Health. Today, our goal is simple: to help you cut through the noise, better understand all of your options, and feel more informed and more confident about this critical decision that you and your family currently face or will face soon enough. And to help us with this, I couldn't think of a better or more qualified person than our guest today, Craven at Move Health. Cole, thank you. We've really been looking forward to this.
Yeah, thank you, Jerry. Appreciate the opportunity. Excited to be here and grateful for our partnership that we have with Presilium and the clients that we've gotten to serve to this point and those that we will serve. And so good to meet you all. If you all are familiar with Zoom, there's a chat functionality. I would love to know where each of you are at and located. If you have questions, you can feel free to pepper those into the chat as we get started. But without further ado, I'm going to share my screen here in just a moment, and we'll get started. So while I'm doing that, if you want to hop into the chat and let us know where you're located at, that would be great for me. I'm in Evansville, Indiana, is where I'm located at. So the heart of the Midwest, and unique to us, we're now I'm an IU fan. Indiana University, and we're now a football school. So this is a unique experience that I've not gotten to have before. And so I'm going to get my screen shared up here. And so if you are here for ACA Marketplace Open Enrollment 101, you are in the right spot. It looks like we got a New Jersey out there, Victorville, California. So it's morning for you. So thanks for joining in the morning. And those that are in New Jersey, obviously, we've just hit the lunch hour. So good to meet you all. Feel free, hey, Scott in Massachusetts, feel free to use the chat functionality for questions. I'll be keeping an eye on that. We'll have some time at the end as well where you could unmute or use the chat functionality to connect and ask a question as well. And so feel free to pepper those in there if there's any questions or thoughts as you go through, and we'll go through. So Marketplace Open Enrollment. Initially, important, get to know who you're talking to, who is this guy, Craven, that works with Presilium. So I'm the co-founder and head of growth at Move Health. And so head of growth means that I get to do things like this all day long, where we work with clients, and many times I'm working with financial advisors, helping to educate them so that they can better serve folks like yourselves. And so, Presilium is a partner of ours, and we love working with them and the clients that we've gotten to share to this point. It's been great. But that's who I am outside of work. Maybe more importantly than the work that I do is this incredible family over here. So this is my beautiful wife, Megan. We celebrated 10 years this year of marriage. It's our beautiful 4-year-old son, Porter, and our newest, Conrad. He turns 1 next week. So we're in the thick of it, I think, as most people would say. And so Southeast Pennsylvania, IU alum, go Hoosiers. Jill will take it. I love that. It's been a fun ride watching IU be good at football, but outside of work, I'm spending a lot of time with our family at this point. So chasing around the boys. I'm a musician. My part of my story is my dad was a touring musician, country musician growing up. And, so I got an opportunity to live that life a little bit. And, so music is a big part of who I am and what I do. Completing a project on our old house. We have an old Tudor home, and it's a lot of fun. We just recently finished. I love working with my hands. So we just recently finished a kitchen and dining room, process just before I tore apart my knee. So I just recently, had my full experience with health insurance, where I got to be on the receiving end of it and maxed out our deductible and all those things, doing a full knee reconstruction about a month ago. And so I just got an opportunity to ditch the crutches recently, which is exciting. But that's a little bit about me. But you're not here for me. You're here for content on the marketplace. And so here's what we're going to cover today. We're going to cover pre-65 individual health insurance. We're going to talk about what options maybe someone in the early retiree space specifically has. And this will be applicable to those that are maybe not early retirees. Maybe you are a consultant, or you're a 1099, or you're someone that doesn't have coverage through a job. But this is going to be solely focused on pre-65 individual health insurance, our presentation today. We're going to talk about advanced premium tax credits, and we're going to talk about the One Big Beautiful Bill from this summer that was signed into law on the 4th of July. And we're going to talk about some of the changes that may be coming up. We're also going to talk about open enrollment timelines and best practices. And like I mentioned, we'll have some time available for Q&A as well. And so feel free to fire those into the chat during the conversation, so you don't or hold them to the end, and we can get them answered for you all. But excited to be here, excited to dive in. And we're going to cover a lot in a little bit of time, but I promise to make it fun. Not everybody's super excited to always talk about health insurance, but it's something that I love and our team loves helping folks to navigate. So, key learning number 1, pre-65 health insurance basics. And so what we're going to do with this segment here is we're going to talk about the options that may be available in the pre-65 health insurance space for individuals that are getting health insurance coverage outside of a job. One thing to note is that in the United States, as we break out how people access health insurance coverage, over 50%, or nearly 50%, I should say, access health insurance coverage through a job. So they're accessing health insurance coverage through an employer. And that is 50% of the United States that is doing that specifically. So 50% of the United States there's 15% that access coverage through Medicare. We're not going to talk about Medicare today, but Medicare is what you typically get at age 65, or if you become disabled prior to 65. Medicaid, that's 20% of the United States population that receives coverage through Medicaid. This is state-based health insurance that is for low-income, typically individuals. It's income-based. The last one, 15% of the United States, falls into this category of what we're going to talk about today, which is I don't have coverage through a job. I'm not on Medicare yet. I'm not 65. I'm not low income, so I don't have Medicaid. I'm not on Medicaid, but I need to buy my own coverage. So 15% of the United States gets health coverage through the individual market. And so we're going to talk about that today, what the options are. And so without further ado, we'll dive into the first option, retiree benefits, right? This might be through an organization. We see this a lot of times in higher education, unions, or large employers. You may see retiree benefits, that exist. What retiree benefits are available through your specific industry? That's going to be specific to who you are and what you have done for a career and all those things. But you'll see railroad retirement benefits, or federal employee health benefits that will roll through retirement, or if you've worked at a large organization or through a union or things along those lines, retiree benefits may be available to you. The pros of retiree benefits, many times they're the lowest cost option when they are available. And typically, again, this is an earned benefit for a tenured career within a specific industry or employer. What we have seen as a trend over the past several years is that retiree benefits, on the con side of things, retiree benefits are getting skinnier, right? It may or may not be the same plan that you were on when you were employed. Your retiree plan might not be the same as your employer plan. So that's an important designation to understand if you have retiree benefits available to you. They can sometimes, if you're within a union plan, they can sometimes have odd exclusions or rules. And so important to read the fine print. And these may require the use of specific hospitals or networks, not dissimilar to other health insurance plans, but sometimes retiree plans are a little bit more specific. And so it's an option that you may be able to exercise, but also understand if there's a cost associated with it. Maybe it's worth looking at the individual market as well outside of retiree benefits. So that's retiree benefits there. The second one here, COBRA, the Consolidated Omnibus Budget Reconciliation Act. If you didn't know what COBRA stood for, now you do. This is legislation from the 1980s under the Reagan administration. And what COBRA does, COBRA is not an insurance carrier. COBRA is not, it's not a snake. It is your continuation of benefits. And so this allows you to keep your benefits that you had through your employer typically for 18 months, for up to 18 months. There are some circumstances where you can keep it longer, and in some states you can keep it longer. But COBRA typically across the country, you can keep it for up to 18 months after you leave your employer. And so this is the benefits of COBRA. There's no change from your employer coverage. It's the exact same plan that you had while you were employed. You go through the employer open enrollment period just like you would if you were an active employee. If you are someone who is retiring mid-year or leaving that job mid-year, your deductibles carry forward. So if you've already paid into a deductible, maybe you had a knee reconstruction like me in September, and you've already met your annual deductible. If I were leaving my job and needed to make a change or explore a change in health coverage, I would probably myself say, I'm going to keep COBRA for the end of the year. Why? Because I don't want to have to reset my deductible mid-year. The other benefit is you know how the plan works. You've been on it and you have used it, and you know that the doctors that you see take it or don't take it, and you know all the pros and cons of it. Some of the cons: usually COBRA is the most expensive option. Like I mentioned, there's a time window that you can keep it for. Usually it's 18 months. And one other thing that's important, we're talking about pre-65 health insurance coverage, but if there's anybody on here that's nearing 65 and is kind of planning, oh, well, maybe I can retire at 65 and I'll keep COBRA for a little while after that. COBRA and Medicare are like oil and water. They do not mix. And so they are not, COBRA is not considered creditable coverage for Medicare. And so that's an important note to make. COBRA and Medicare don't mix. But those are some of the cons. So that's COBRA. You keep your employer plan and you're used to it. You know how it works, but it's typically the most expensive option. And the reason that it's the most expensive is you're paying 102% of the full cost of the plan. And the reason that you are doing that is you are not only paying the employee price, you're also paying what the employer was paying on your behalf. And you're paying a 2% administrative fee because an HR department typically outsources COBRA, to an administrator that's going to take care of that. And so that 2% fee goes to the administrator. And so it can be expensive. So COBRA. Short-term major medical. This could be a good option for healthy individuals with a short-term need for coverage, right? So typically short-term major medical, you could loop this into a phrase called off marketplace. And sometimes there's even this thought of it's kind of a black box or a Pandora's box, maybe I should say, of and I'm going to use air quotes here, of private insurance. Private insurance is a bit of a misnomer, and a lot of times everybody has a different definition for what exactly it is. There's typically on marketplace and off marketplace is kind of how we would reference things. Short-term major medical fits into the off marketplace category. The benefits of a short-term major medical plan, it's going to be a good option for healthy folks, and they're going to have larger networks, and they can offer these larger networks because there's usually some form of medical underwriting associated with them. So because they can kind of pick and choose their people that are allowed onto the plan, they're able to offer wider networks. Many times it is a lower cost than an unsubsidized marketplace plan. We're going to talk about tax credits in the marketplace here in just a little bit. And there's no special enrollment period needed for short-term major medical. And so coverage, you could enroll today and your coverage would start at midnight tonight. Some of the cons, right? Most are not ACA compliant. This means that they are not going to cover, in many cases, pre-existing conditions, pregnancy, or prescriptions. And so I call that the 3 Ps. So short-term does not cover the 3 Ps, which are pre-existing, pregnancy, or prescriptions. Most are medically underwritten, and there are limited terms available or no terms available, right? As someone that may be in New York, short-term major medical is not available. It's on a state-by-state basis where it may or may not be available to you, and each state's going to have their own regulations specific to short-term major medical. So this can be a good option for folks that are bridging a short gap. Healthcare sharing, this is an option, again, a very niche tool in a tool belt. It's a non-insurance alternative for individuals and families. The pros of a healthcare sharing plan is that many times it can be half the cost of an unsubsidized marketplace plan. Typically, there are larger networks or sometimes even no networks, and there's no special enrollment period needed. Now, they may or may not be ACA compliant. Many times, if they are ACA compliant, they're ACA compliant, Affordable Care Act compliant, based upon a religious exemption. So typically a healthcare sharing program is going to have some type of a faith-based component to it. There are no guarantees since it is not insurance. There are some large healthcare sharing programs that have been around for 30 plus years and are large and very stable. There are other smaller healthcare sharing programs that may fizzle out or be insolvent, and that could leave someone in a tough spot. So healthcare sharing is something to be very thoughtful around if it's if you're potentially considering it. Make certain you're doing a great job vetting that. But there are pros and cons to each of those. Last but not least, and where we're going to spend a majority of our time today, is in Affordable Care Act marketplace plans. You might hear these referenced as the ACA or the Marketplace or Obamacare or insert name. For those of you that are in state-based marketplaces, I see Jill's in Southeast Pennsylvania. That's called Penny is the marketplace there. We've got some folks that are in California. That's Covered California. New Jersey, it's Get Covered New Jersey. Massachusetts, it's the Massachusetts Health Connector, right? So there are state-based marketplaces as well, but they are usually referenced as the marketplace. Now, the Affordable Care Act marketplace, the Affordable Care Act was written into law in 2010. And this was written into law by the Obama administration. It said, there were a lot of things that were included in the Affordable Care Act, but in regards to the marketplace, they said, we're going to create a marketplace where people can get coverage for pre-existing conditions. Prior to 2010, this was a big problem where you would have an early retiree that may come to, us at Move Health, and they'd say, hey, I'm 61. I'd love to retire. I just need to figure out health insurance. And my financial advisor said I should talk with you. Okay, great. No worries. Tell us about your health history. And that's the question we would have to ask before the marketplace. And the reason we had to ask those questions was we were then determining, would an insurance carrier actually underwrite and accept this person? So prior to the Affordable Care Act, people had to medically qualify. So a big pro of the Affordable Care Act is it's going to cover pre-existing conditions. Rates are based on age, location, and tobacco status, right? So there's no questions aside from smoking status that are related to health at all. You can be undergoing current treatment for something, and your new insurance plan through the marketplace would start picking that up. With subsidies in place, and we're going to do a deep dive on tax credits. With subsidies in place or tax credits, it's usually the most affordable option. And so we'll talk a little more about that. This also allows massaging of modified adjusted gross income to help lower premiums. One thing about the Affordable Care Act is the marketplace specifically is they're looking at your modified adjusted gross income for the year in which you need coverage to determine if you can receive subsidies on the marketplace. And so they're not looking at your assets. They're not looking at years previous of income. They're not looking at what you expect to earn in the future. They're just looking at what your income will be for that year. And so as an example, my in-laws are on an Affordable Care Act marketplace plan here in Indiana where I'm at. And they did some financial planning with their financial advisor, and they said, we want to be able to take advantage of these advanced premium tax credits. And this will make a little more sense here in a moment. But my in-laws right now at 63 years old, they pay $11 a month for their health insurance on the marketplace. And so there are ways that you can do that. Not everybody has the same amount of flexibility in order to do that, but with a financial planner, you can unlock some opportunities. So that's a pro. The cons of an Affordable Care Act marketplace plan. Sometimes these can have restrictive networks. That's what you'll hear about the marketplace. They can, if you're taking advantage of these advanced premium tax credits, require a little extra legwork during tax time. The 1095A is a form that you get that turns into IRS 8962. Don't expect you to remember any of that. You don't have to write it down. But it can require a little bit of extra legwork to reconcile your tax credits, but not a huge amount. And then it can have higher out-of-pocket costs than an employer plan. So that's something to consider as well. So as we go and do a little bit of a deep dive on the Affordable Care Act, did you know, this is something that some people still don't know, as a result of the Affordable Care Act, individual health insurance is now guaranteed issue if you're buying it through the marketplace. You can't be denied or rated up because of a pre-existing condition. Many of us have made it to age of retirement or what have you, and we've gotten to that point, and it hasn't been without some bumps and bruises and maybe a couple pre-existing conditions or prescriptions or things like that. It's okay. You can get health coverage outside of a job. Coverage on the marketplace is available through major insurance carriers. So this is not this is not Daffy Duck Insurance. This is the United Healthcares and the Blue Cross Blue Shields and insert name of popular carriers. They participate in the marketplace. And so did you know that? Key learning number 2, We're going to talk specifically about the Affordable Care Act marketplace, and we're going to talk about these things called advanced premium tax credits. And I'm going to break that word down, or that phrase down, of advanced premium tax credits here in just a moment. What are advanced premium tax credits? APTCs, or advanced premium tax credits, they're a federal subsidy that were created under the Affordable Care Act. So you can imagine when the Affordable Care Act rolled out and the marketplace was started in 2014, and they said, hey, if you want to participate in this rapidly growing marketplace, you need to, as an insurance carrier, accept everybody. And, these insurance carriers pay these people on their team called actuaries a lot of money. And actuaries are people that are really good at math, that their job is to determine risk. And when they hear we have to accept everybody, they go, oh man, we have to figure out a way to, put everybody in the highest risk pool. And so from January 1st, from December 31st, 2013 to January 1st, 2014, when the marketplace began, health insurance premiums on average went up 300%. Now, the federal government at that time knew this was going to happen. And so they created these things called advanced premium tax credits, this federal subsidy. And their purpose is to be federally earmarked dollars that make health insurance premiums affordable for individuals and families that are purchasing coverage on the marketplace. You can't apply advanced premium tax credits to Medicare or to Medicaid or to your employer plan. They're only if you're purchasing through the marketplace. And they're advanced because they're applied before taxes are filed. So it's directly subsidizing and lowering your monthly premiums month to month. And so as an example, you might have a $1,000 monthly premium, right? Just as an example, a gross premium of $1,000. And they'll say, based upon your income, we're going to subsidize $500 of that. You pay $500 a month to the insurance carrier, and the federal government is subsidizing the other $500 and paying it directly to the insurance carrier. And so right, wrong, or indifferent, however we feel about the federal government paying health insurance premiums, the Affordable Care Act made that possible, and there are ways to take advantage of these. So these are what advanced premium tax credits are. Why do advanced premium tax credits exist, right? Before the ACA, many Americans couldn't afford private insurance. Like we talked about, they would either be rated up or denied before the Affordable Care Act. So advanced premium tax credits were designed to offset the cost of marketplace plans. When the actuary said, hey, we're going to raise rates by 300%, it encourages more healthy individuals to enroll, and it balances the insurance risk pool. It can also reduce the number of uninsured Americans. That was the big goal of the Affordable Care Act marketplace. And it's funded through the federal tax system. It's a refundable tax credit that is tied to income. And so it reconciles at tax time when you take advantage of these tax credits. And the goal is to offset the cost of a marketplace plan. So you heard me mention that other options off marketplace, may be less costly than a fully unsubsidized marketplace plan. A fully unsubsidized marketplace plan can be expensive, but if you can apply these tax credits to them, they become more affordable. Moving on, how do APTCs work? You estimate your income for the coverage year. The marketplace then calculates your expected premium contribution. This is based on a sliding scale, which I'll show you. And the federal government pays the difference between your expected contribution and the cost of a benchmark plan, which is the second lowest cost silver plan in your zip code. The credits applied to lower your monthly premiums in real time, like we talked about, and you reconcile the credits when you file your tax return. You get a 1095-A, which then informs Form 8962, which I had mentioned. Who can get advanced premium tax credits? You can qualify for these if you enroll through a marketplace plan on the exchange. You have a household income between 100% and 400% of the federal poverty level, and this is looking at the current year's modified adjusted gross income. And if the subsidy cliff is waived, we'll talk about that. This is partially why the government is shut down right now, which we'll talk about as well. And you're not eligible for other minimum essential coverage like employer plans, Medicare, or Medicaid. So if you have any of these three options, employer plans, Medicare, Medicaid, you cannot take advantage of an advanced premium tax credit. So you have to buy health insurance through the marketplace. So does that mean you are taxed on the part that the government pays? Great question, Allie, I believe. You are not taxed on the part that the government pays. It's a federal tax subsidy. So they're actually just paying that basically on your behalf. You're not taxed on that. Good question. It's not counted as income for yourself. Timeline of ACA tax credits. How long have these been around and what changes have been made, right? So 2014, we talked about that increase in 300% increase in premiums. The marketplace was born, coverage is guaranteed issue, and there were subsidies or these advanced premium tax credits for those within 400% of the federal poverty level. March 11th, so for 7 years, this existed just as it is here. For 7 years, it existed. March 11th, 2021, the American Rescue Plan Act was passed. If you guys remember this was a COVID relief era. And one thing that they did is they said, we're going to make subsidies or these advanced premium tax credits available for those that are over 400% of the federal poverty level. I'll give you a chart here in a moment that will make more sense there. And it limited plan premiums to 8.5% of modified adjusted gross income. And so if somebody stopped me in the ice cream aisle at the grocery store, I've got a 4-year-old, so I spend some time there. They would say, hey, Cole, do you know what my health insurance is going to cost when I retire? Okay, tell me what your modified adjusted gross income is going to be. And, as a result of them removing the subsidy limit or threshold of the 400%, I could say, based upon your income of $100,000, I could tell them you're going to spend about $8,500 a year in premium, right? So that's what happened. The American Rescue Plan Act, it took the threshold of 400% off, and I'll show you that chart here in a moment. In 2022, the Inflation Reduction Act was passed, and it lengthened these American Rescue Plan enhanced advanced premium tax credits. If you've been watching the news and wondered what these were, this is it. The enhanced advanced premium tax credits were extended through the end of 2025. Now here we are at the end of 2025, coming into the open enrollment period. American Rescue Plan subsidies are set to expire at the end of this year, and the reintroduction of the 400% federal poverty level income cliff is coming back, right? So that's what we have to plan for. Again, the government is shut down as they negotiate if they want to keep these enhanced advanced premium tax credits or not. We at Move Health have to move forward with the intention that, just as legislation states, that the 400% FPL income cliff is coming back, and that we need to plan around that and help our advisors and clients to plan around that. Here's how tax credits work right now and how they've worked since 2022. They work on a spectrum, with plan premiums being subsidized down again to 8.5% of your modified adjusted gross income or less. So as we look at 2025 federal poverty level numbers, as we go all the way here to the right on a household size of 2, $85,000, 84.6 is the number, is 400%. You would have to stay within that to get these tax credits typically, but because of the legislation from 2022, those that are above 400% are receiving tax credits on the marketplace right now. And it's just subsidizing the plan cost down to 8.5% of their income. So tax credits are available to folks that are over 400% in 2025. Now, this is how it's going to work moving forward, right? If and when the income cliff returns, right? So, and I say if and when because, again, the government is shut down and they're feuding over, do we want to keep these enhanced advanced premium tax credits or not? Do we want to make changes? Where does it fit into the budget? Does it not? Does it? And so there's bipartisan from my standpoint and what we know with our ears to the ground in this space. There's bipartisan support to keep the enhanced advanced premium tax credits in place. It's just where the funding is going to come from. The Republican Party does not want this as a part of the budget, and the Democrats do. And so, it's a totally apolitical, conversation we're having today, but this is how it works right now, and part of why the federal government is shut down, because they can't come to an agreement on this. But when the income cliff returns, which is how we have to proceed, tax credits will be unavailable. These advanced premium tax credits that make health coverage more affordable will be unavailable for those with modified adjusted gross incomes above these thresholds, right? So you can see over here on the left, we're looking at people that are in the tax household. And so as I think of an early retiree couple like my in-laws, I typically use the 2-person household, and I come over and I say, okay, next year, you would need to be within $85,000 of modified adjusted gross income in order to receive a tax credit on the marketplace. If you are above that, you are going to be paying full price for a plan on the marketplace. That's something that we help financial planners and their clients to navigate often, and we're having a lot of conversations around that right now. Some folks that are on this call, it's not going to be possible for you to have incomes that are below 400% of the federal poverty level or within it. So we have to plan for full price marketplace coverage if that's the route that we need to go, or we would look at alternatives like what we talked about at the beginning of the call. And so this is what it may look like. And so feel free to pepper any questions that are in there about that. This is a big chart. We'll make certain that you get the documentation here as well. You get this slide deck so you can review it in the replay as well. As we think about the One Big Beautiful Bill Act, what happened with One Big Beautiful Bill Act, in regards to HSAs? If you're on the marketplace and you're on a bronze plan, in 2026, all bronze plans are going to be HSA eligible. And so that's a big change. So you can be on a bronze marketplace plan and contribute to an HSA. Prior to this, it had to specifically be an HSA eligible plan. So if you're on the marketplace and have a bronze level plan, you will be able to contribute to an HSA, and that'll be a good thing for you all as well. And so a couple other things that changed in regards to HSAs specifically within the One Big Beautiful Bill Act: extension of high deductible health plans. And so what this means is high deductible health plans can cover telehealth before the deductible is met. So you can go telehealth. Typically on an HSA eligible plan, nothing can be covered aside from preventive care before the deductible is met. This is an extension saying that telehealth can be covered before the deductible is met. Direct primary care, this is new for 2026. Some of you may use direct primary care or concierge doctors. This is now an HSA eligible expense, right? So for those that are using concierge medicine or using a direct primary care physician, this is where you might pay an annual or monthly fee to be able to see this doctor. They don't bill insurance. It's now an HSA eligible expense. What's not in? We thought that there may be some increased contribution limits. They were proposed, but they didn't make it into the documentation. And so important to note that there's some changes that are coming to the One Big Beautiful Bill Act as a result to HSAs. Good news for bronze folks that are on bronze marketplace plans: contribute to an HSA. Telehealth, HSA eligible. Direct primary care, now HSA eligible. So good things there. Key learning number 3, we're going to walk through some important timelines kind of as we land the plane, as we've learned a lot of things today about options that are available, as we learned about the Affordable Care Act and advanced premium tax credits, what they are and how they work. And now we're going to learn important timelines and enrollment period details, right? So here's some key dates for the marketplace. I'm going to talk about the federal marketplace. Your state-based marketplace may have slightly different numbers or dates that are specific to it. And feel free to reach out to us for any questions or ask those questions, and I can provide those to you. They may have differing open enrollment period timelines. So check your state website, whether that's Covered California or Get Covered New Jersey or Massachusetts Health Connector. They may all have different timelines. So enroll by December 15th for a January 1st effective date. If you don't do your enrollment by that point, you may passively renew, or if you want to select a new plan, you have until January 15th for a February 1st effective date as well. What you can do during this time on the marketplace: the Affordable Care Act marketplace, you can enroll into for the first time or change your entire health plan on the marketplace. So you can do that during this window of time. So there's some key dates to keep in mind: November 1st through Jan 15 on the federal marketplace. States may have slightly different. Typically, they're more lenient. What to verify during open enrollment period? These are all important things to check into. Are your doctors in network with the plan, right? Provider networks change year over year. This is an important thing to make certain that you are in tune with. The drug formulary: are the meds that you take covered? Did you start taking a new medication this year? Is it covered on your plan? Drug costs: are they covered? And if they are they affordable, right? Is there a better option out there that may lower your prescription drug costs? Rate increase: is there a lower cost alternative that still meets your specific and unique needs? One thing about health insurance is not one size fits all. And so whether you're on the pickleball court or the golf course or lunch with a friend, their health insurance needs are not your health insurance needs. And so, just make certain as you're thinking about, you hear somebody saying, oh, this carrier got so expensive this year. That could be for a variety of reasons, and it's specific to a zip code and a person and the coverage, right? So important there. HSA eligibility: can you contribute? Is it a part of your financial plan? Consult your advisor. This is the value of working with Move Health. We have that direct line to your advisor as well. And so whether it's John or Brooke or another member of the team, check if your plan is HSA eligible and check with your advisor if that makes sense for you to do. Out-of-pocket maximum, and deductible. Do you understand your full exposure? Make certain you have a full understanding of what your costs may be in your worst year and plan for it, right? We hope that we don't have worst case scenarios, but we do need to plan for them. So do you understand your full exposure? And what we believe fully and firmly is that health insurance should be reviewed at least annually. And so these are things to verify during open enrollment period. And these are good things to verify during open enrollment period, whether you're still employed too, right? Do this. You can do this yourself. Make certain that all of these things ring true. But these are things that you can verify during open enrollment period. Should I review my coverage? It's a great question. Yes, if you are a pre-65 retiree, small business owner, or you're someone that's responsible for buying your own health coverage. This is the time of year that offers you the most flexibility. You might be someone who's on COBRA and want to explore ending it early, right? Many initially choose COBRA due to administrative ease, but it can be expensive. And maybe you've had recent changes to health or your location or your income. Maybe you had a high income in 2025, but 2026, you can keep your income lower and take advantage of some of those advanced premium tax credits. Maybe that makes sense. Maybe you want to evaluate HSA compatible plans. We've talked about that a little bit today. And maybe you're someone who's now, looking to optimize your coverage, or you can now access an advanced premium tax credit. So yes, you should review your coverage at least annually. No one ever wants the situation where they get into a car accident and then realize they have a bad, auto policy, right? You don't want to figure out that your car insurance stinks once you get in a car accident. You want to know beforehand, right? And so before you have a health issue or need, know how your health coverage works. And one of the things that I feel passionately about as we build Move Health is that, I tell it to our team all the time, is, we really want to help people improve their healthcare literacy. And at its core, what that looks like in practice is, does someone understand what it's going to cost when they go to the doctor? And, not many people can answer that question in the United States with accuracy. And so should you review your coverage? Yes, if you are any of these things, or if this spurred any thoughts for you. So with all this information, what are your next steps here? As you've attended this, looks like we've got several people that are on the call. What are your next steps? Well, Presilium has, partnered with us at Move Health to do your annual review if you are someone that needs that. This is a health planning analysis that we create on your behalf. You complete a household profile through your Move Health dashboard. Your advisor starts the client engagement. You are sent what's called your household profile. You fill that out and you give us your doctors and your meds and things along those lines, that allows us to then go do a health plan analysis and say, you're maybe in the right spot, or here's what we would recommend as well. So we'll give you insight to provider networks and HSA eligibility and coverage for medications and doctors and those things. We'll also provide a couple of other things around, carrier stability, and your specific drug costs and things along those lines. So we also do the same work in the Medicare space. So keep us in mind for family and friends, and make certain that you send them to your advisor to start that process. So no worries there. Your firm's partnered with Move Health to do your annual review. And so this is the point where I say thank you for attending, and I'm happy to answer questions. And it looks like we had one that popped in there. Great question from Allie. Looks like she's in New Jersey from earlier in the presentation. She said, when talking about a location being a factor in pricing, is the location state or town specific? My answer to that is neither, but closer to the town specific. It's actually zip code specific. And so as we look at that, it's going to be something where you're going to plug in a zip code, and that will actually determine maybe what plans are available in your area. And then that also is determined where that benchmark silver plan lands. The lowest cost silver plan, second lowest cost silver plan in your area is what benchmarks the cost for all other plans in that area. Great question. Any other questions that are out there, feel free to fire those into the chat. Great. There's Jerry's joined back in. Jerry, do you have any questions after a presentation?
No, I thought that was excellent, Cole. Thank you very much.
Of course. Yeah. Happy to help out. Well, thank you, everybody. If you do have questions or want to do an annual review, Jerry and Brooke and the team at Presilium can kick those off for you. And so feel free to connect with them for a health plan analysis. We'd be happy to help out and to serve you. Looks like Jill has a question. There's one in there. Child turning 26 in May. How soon should we start working on this? Great question. We typically recommend 60 days before that change is taking place. And so for those of you that may not know, when the Affordable Care Act also made a change to how long a child can be on a health insurance plan. And that is up to age 26 for ACA compliant plans. And so if you have a child that is turning 26 and they're currently on your health coverage, it is time for them to buy their own health coverage.